Hi, my name is Peggy Chel, and I work for a federally qualified community health center on the near west side of Cleveland, neighborhood family practice. And first I want to thank you for coming here and sharing your views and your plans and understanding how important this issue of healthcare really is. It's certainly a bipartisan issue because everyone's suffering. I just need you to know that 2.8 million Ohioans live at or below 200% of the poverty level. And, oh wow. And 1.8 million live between 200 and 300% of the poverty level. Those at 200% cannot afford to contribute anything to their health care after they take care of their other basic needs. Those between 200 and 300% have a limited ability to pay for health coverage depending on family size. Those people are going to be in trouble and are in trouble now. And those are basically the people that my organization takes care of. And I'm concerned about further privatizing healthcare, basically because the insurance company have made life or death situation choices and decisions on people's health care, and because they've gone home with billions of dollars in bonuses as a result. And so I'm certainly interested in your plan. I'd love to hear more and I'd love to participate more. But I also would like to hear you address the huge insurance lobby and how they have kept themselves making billions of dollars at the demise of American citizens.
Thank you. First of all, let me just say in the beginning, I believe and am a strong supporter of community health centers, and I think we need a lot more of them. I think we need a lot more of them in my home state of Arizona as well as across this country. And the most dedicated people I know are people who serve there in community health centers, including physicians and nurses and others, because as we all know, their income is limited. So I'm a great believer and supporter of community health centers. In addition to the numbers that you gave, as you know, there are 47 million Americans that are without health insurance today. Now, half of those people are people who are between jobs. But as we see economic conditions worsen in America, more than 250,000 Americans recently and suddenly lost their jobs, that number is going to increase. And the other half are people that are children. There's 8 million children that are not signed up for S-CHIP. There's other people who simply have chosen not to take insurance. But the fact is that there's also a large group of Americans who are in a category where they simply can't get insurance. That's why I talked about this guaranteed access plan, where we are going to have to work with the states and the governors, and there's 20 states now that have enacted some laws that restrict the size of premiums and do other things, and there's proposals on the table in states to have risk pools to provide the proper funding, and it's going to require a federal contribution to care for the chronic disease pre-existing condition group of Americans who simply under any circumstances could not afford. And frankly, some of those people are the people that you see at the community health centers as well. And we see at the emergency rooms all over America because they can't get health care anyplace else. And you know better than I do that emergency room care is the most expensive form of health care in America. And I'm insulting your intelligence by telling you these things. But it brings me to my point that I don't believe you said you don't think it should be further privatized. I think that's probably true, but I also don't think we should have greater government control over healthcare system in America. I think if you go to Canada or you go to some other countries where we have government healthcare run systems, I don't think you would find the quality of healthcare in those countries at a level that we Americans have grown to expect. So one of the fundamentals of the proposal that I have is every family in America have a $5,000 refundable tax credit. and they would be able to grow across state lines and shop online or anywhere in America and purchase a health insurance policy that suits them and their needs best. Right now, when you have employer-provided health insurance, you don't have a choice. You take the policy that your employer gives you. Or in the case of small businesses, that employer can't provide it. So we have no money now to purchase a health insurance policy. At least you've got $5,000 in a refundable tax credit where you can go online, you choose the insurance company of your choice, and since you're not confined to the state of Ohio, you can go any place in America. Then these insurance companies will have to compete more effectively against each other. It's competition. Whenever there's a company or corporation in any line of business in America, in this world, that corner the market and squeeze out competition, then costs to the consumer go up. So I think that one of the key elements is for us to give every American family this refundable tax credit so that they can choose the policy that best suits their family's needs. And I don't believe that employer-based, if somebody wants to keep their health insurance policy that their employer is providing, fine. That's fine with me. But I also want to give them the choice. Now, we need walk-in clinics. We need to have community health centers. We need to have outcome, as I mentioned in my earlier remarks, outcome-based treatment. My friends, if a person has one of these 5 diseases that I was talking about, and you pay for every procedure, every test, every visit to a doctor, obviously the costs go up and up and up. I want to tell a healthcare provider, here's a patient with a chronic disease, treat him for a year, and here's a certain amount of money, and if that patient is in good shape after that period of time, we will reward you, but give them their care. Number 2, there's a program called Cash and Counseling, where seniors are given the money. They're given the money by the federal government to take care of their own health care needs, and they choose which doctor or which healthcare provider that they need. And you know what we find out? The obvious. When they're making the decisions, that they're far wiser. They're far wiser than they were. And finally, we need to put the choices into the hands of the patient, and that's the whole theory behind that. There's many other steps that we need to take. One of them is malpractice reform. I think it's pretty clear that any doctor in this room will tell you that they either have to or their associates prescribe unnecessary tests or procedures because of their fear of ending up in court. And finally, what we've seen here, and I'm sorry for the long answer, but you really have put your finger on a fundamental problem with healthcare in America. What we've seen here today and what we have at the Cleveland Clinic is remarkable. We have patients having access to their records, to their healthcare records. We have patients in direct contact, no matter where they are in the world, with their physician and their provider. We have patients and healthcare providers, whether they're on vacation in California or not, as Dr. Harris was, where they get online and they notice that a patient, as a result of a test that they've read online, needs to come back from their vacation and get additional tests. They don't have to thumb through the stack of records and x-rays. They're all online with them. They've got a partnership with Google. By the way, I have no stock in Google. Where it's going to be just like when you Google somebody, only they're going to have privacy, where there's going to be a record. There's going to be a record. If they have an allergy, what their previous health care record was. Can imagine. And all of this that's being done, and it's happening in other places in America. It's just happened to be done very well here at the Cleveland Clinic, is we're going to reduce costs. We're going to reduce paperwork. We're going to put everything online, and we're going to reduce costs. Because the problem of healthcare, if you forget everything I say to you at this town hall meeting, and I'll stop with this, it is not the quality of healthcare in America that's the problem. It's the cost of healthcare in America that's the problem. And if you have double-digit inflation, or this incredible, nearly so, in healthcare costs in America, we will never achieve our goal of making healthcare available and affordable to all Americans. Yes.